We welcome you all to Talk the Talk. My name is Janine Stiene,
And I'm Toni-Ann Antoniato.
the Masters of Myofunctional Therapy.
Together, we interview physicians, dentists, and other professionals to learn how their expertise can benefit you, your child, or your patient's speech and language skills and complement the services they are receiving. Welcome to this episode of Talk the Talk. We're joined today by Dr. Victor Avis and his daughter, Sydney Avis. They are the founders of a nonprofit organization, the Airway Revolution Foundation. Dr. Avis is a third-generation dentist who values whole health and practices airway-centered orthodontics. Sydney is an inspiration and true survivor of airway health disorders, a certified yoga instructor, and health coach. Welcome the father and daughter team, Dr. Avis and Sydney.
Welcome.
Thanks.
We're so excited to have you.
Likewise.
Thank you.
Thanks for having us.
So we had the pleasure of meeting you, Dr. Avis and Sydney, at Dr. Siegel's exclusive preview of a docuseries, Breathless, back in January. And we watched an extended trailer of a documentary series that was 7+ years in the making. So if we could start there, and if you guys can both share with the audience a little bit about this series and the very personal story about how it came about.
Absolutely. You want to
Yeah,
start?
sure, I'll start. I briefly, back in 2008, I'm a general dentist. I was always curious about orthodontics, so I went back to school to learn orthodontics. And no sooner had I finished my program and I had done one of my initial cases was an extraction case of 4 bicuspids. And I had another young lady in cervical headgear where you put a strap around the neck and it's designed to keep the maxilla from growing forward. And I'm seeing the horror on Janine's face. And about that time, a mentor of mine in gold inlays and onlays, nothing to do with ortho, knew I was going back to school for this and said, "Have you ever heard of a guy named John Mew?" I said, "I hadn't." He said, "You should look him up on YouTube." I looked him up and he offered a chapter of his book, The Cause and Cure of Malocclusion, for free. So I downloaded it, I read it, and then for 2 weeks I was like, oh my God, if this guy's right, what I'm doing for this young lady, Olivia, is totally wrong. And finally, I was bugging my wife so much, she said, for goodness sake, go to England and find out. And so I knew at the time John Mew was 80. I didn't know how long he'd be around. He's still at 94, 95, he's still going, but I went out to study with him and his son, Michael, and it changed my whole concept, not only of orthodontics and breathing and nasal breathing, things I had never heard anything about. When I was out there, they had a book on their coffee table called Close Your Mouth. And it was a little book written by Patrick McEwen. I was like, what is this about nasal breathing? And I would walk about 45 minutes back and forth. And I took a friend, a lab technician, who's a great thinker, with me. And we would walk and try to breathe through our nose. And it was, novel experience. And, I'm, almost 50 at the time. And I was like, that I'd never heard of this. So anyway, it set me on a very different path in my orthodontic treatment. And then I looked for a mentor in the United States because I needed help with these cases. And so I understood that Bill Hang had studied with John Mew and he was still teaching. And I needed a mentor. So I signed up for his class in California. And he did not only teach, but he had an ongoing mentorship where we presented cases. And it was small. I mean, there's single digits of people who are involved in this, not thousands, not even hundreds. And so we would present cases. And then I started to recognize, oh my goodness, I think my own daughter, Sydney, has an airway problem. And so I presented, he was doing a course in Connecticut, Dr. Hang, and I brought Sydney's models and her pictures. And I knew him quite well by that time. We'd probably been studying together for 3 or 4 years. And he took one look at it. He said, she needs surgery. And I said, I knew you were going to say that. And Sydney knew I was presenting her case. Sydney at the time was probably around 24, 25.
Mm-hmm.
And she said, well, what did Dr. Hang say? And I said, I thought she'd be very disappointed. He said that you need surgery. And Sydney's response was,
Let's do it. Let's go.
Wow.
Yeah.
Let's do it now.
Yeah. Wow.
and then I put on the brakes. I said, whoa, you can't just do surgery, because like most dentists and most ENTs and most pulmonologists and most speech and language people, we all believe that jaw surgery is radical and it's like the last thing you do. And I'm telling you, I feel totally different about that, as does Sydney. Hopefully we'll get to that. But I said, we need to do a sleep study. We hadn't done any of the diagnostic work. So I said, I can't just, appropriately recommend surgery to you, my patient, my daughter, one of the most important people of my life, without, doing due diligence. And so she said, okay, well, let's do it. And I said, well, it's interesting. You're a healthy vegan, you exercise, you're a yoga teacher, you meditate. I said on 3 of the 4 areas that we consider the foundation for health, which is exercise, stress management, nutrition, you are knocking it out of the park, and yet you always feel exhausted and stuff. And I said, if we fix your sleep by treating your airway and it makes a difference in your life, that could be an amazing story, because most people said associated, sleep disorders with overweight 50-year-old men, and you are anything but that. So I said, let's film it. And I was thinking that we should take a film with my iPhone.
And I've seen him with his iPhone. And what are you gonna do with that?
Which I did not have a good answer. And
Uh-huh.
And then we called friends who also happened to have won 17 Emmy Awards, which is always handy. And, told them kind of what was going on, and they thought we were crazy. They were like, she's young and healthy. What does she need surgery for? We'll start filming. It'll be fun. We'll see what happens. And that was just how it started. There was no contract. There was no plan. It was just, we'll start filming and we'll see. And that was the beginning to this whole wild project that we've been on now for 7+ years, like you said. I think it's important, Dad, because, just to talk about why did we think that there was an issue going on with me? Because you said like she was exhausted and stuff, but I think that there were so many components to it and so many things that we weren't even thinking were related to each other, or that could be caused by not breathing or not sleeping properly. Which retrospectively, of course, it's all connected and can be caused by that. But, I think we should just talk a little bit about what that looked like. So maybe from like a dad's perspective, looking at your child, what was that like?
Yeah, so with great humility, I didn't know what I know now. So when Sydney was young, she had trouble with breathing. We took her to NYU to a pediatric allergist. And he said, well, she's allergic to your dog, get rid of your dog. But it was very flippant, it was one of those, like 5-minute visits. And I didn't say it, but I was like, well, you go get rid of your dog, because we have this black Labrador retriever that we had before Sydney was born.
And I'll get rid of Sydney before
his name
that
was
dog.
Duke. And
Yep.
it was an absurd suggestion to me
Right.
at the time. And it would have been absurd to Sydney, who loved the dog. But again, I didn't recognize how critical breathing is to the development of your craniofacial structure, in short, your face and your airway. And so, okay, we're not getting rid of our dog. And so Sydney had, she played basketball, she had an inhaler, and she'd use a nebulizer from time to time. And that was Sid. And then, so we didn't connect this to anything down the line. She had crowded teeth. So I thought I was smart that I didn't want my daughter to have extraction. So again, at the time, I didn't do ortho. This is back in 2000, around 1998. And I sent her to an orthodontist to do expansion, which I now know is not the expansion that I would consider expansion, because in orthodontics, you learn that the lower arch is your limiting arch. And so you're only going to expand widthwise, transverse, as much as the given lower allows you. And so in Sydney's case, she didn't have a crossbite, so she got a little expansion. It was much ado about nothing.
Right.
But I didn't know. And then her teeth were crowded. So then she had her first round of orthodontics. And then she got the braces off. And then the lower teeth crowded within a year, and she went to Invisalign. And so it was literally 12 years of orthodontics from age 8 to age 20. And all at the end, I can show photos, she has straight teeth, but nobody connected it that along with this breathing issue, meaning she had asthma, the nebulizer, then she developed, well, why don't you talk about it? It's your struggle.
I was very cranky
Yeah.
every day, not just some days, every day. I had some behavior issues. School was extremely difficult for me. It was like climbing a mountain every day. I worked really hard, but I could not concentrate. I could not remember the things that I had studied. I would do the reading and then get in trouble because I didn't read, because I would be totally on my quizzes, but it's just because I couldn't remember what I'd read the night before. So school just became a place that really, hurt my confidence, and I felt stupid most of my life. And which also perpetuated a lot of anxiety in classroom settings. And I just struggled with mental health. I hated going to school. I didn't want to go to college because I didn't want to go through that again. That was kind of like the biggest hurdle. I was also exhausted the entire time trying to, go to school every day, play sports. I made it through and I did it all, but I was exhausted and I was unhappy. I developed panic attacks like in my later years of high school and throughout college. I had extreme gut issues to the point like I really couldn't eat anything. I was having smoothies and I would still bloat out. And I went to see so many different people of how to get that treated, and just nothing was working for me. So these things just kept kind of piling on top. And then I was diagnosed with thyroid disease. So it just kind of, that's when Dad started questioning like what's going on here, because like he said, I was healthy, right? I was doing all the things that I'm supposed to be doing, but I was struggling. I was really struggling. So yeah, I think there's just so many components, and everything, relates to each other. So if you're not getting the proper sleep that you need because you're not breathing properly, it manifests in different ways, and it looks different for different people. But I think mental health, learning challenges, anxiety, gut, there's so many things that could be a red flag saying there's something deeper going on here. Yeah.
What types of recommendations or interventions were these other professionals that you were seeking based on your symptoms recommending? And I have to assume that none of them had anything to do with dentistry.
Yeah, so I think I'm glad you asked that, because I think one of my take homes through this experience of making the film, and we're not the filmmakers, but we certainly have been like the key consultants on who our filmmakers should interview, film with, and the stories that need to be told. So it's a film it's not Sydney's story. Sydney's story is in the film, but so are the stories of many other people. Some have been helped by tonsil and adenoid surgery. Some have been helped by myofunctional therapy. Some have been helped by CPAP machines and Inspire and MMA surgery. So we have loads about the journey, and the diagnosis and treatment has to be very personalized. So we go through that. But when it comes to Sydney, I think one of the key learning points is that the whether it be the SLP or the dentist or the physician, you need to listen to the patient. And if the data, particularly from the sleep study, doesn't support or correlate with the symptoms of the patient, don't doubt the patient first, doubt the sleep study. And there's so much fallacies to sleep studies. I have a slide that Gerald Simmons from Houston shared with me, and he shows the same sleep study, and it's scored by one person as 1.5 AHI, meaning 1.5 events per hour.
Yep.
And it scored the same study as 24 AHI, 24 events per hour, which is considered moderate sleep apnea, and 1.5 for anybody but a child would be considered no sleep apnea. And so, well, what's the difference? It's how the test was scored. And so if there can be that much variability, which there is, because it depends upon who's, there's a sleep technician that's actually administering, putting on the wires in a polysomnogram, and then supposed to look at the patient while they're sleeping and score events. And if the patient wakes up and they're not paying attention or they're not looking, they miss, and the test can become very inaccurate. And even in the criteria by the American Academy of Sleep Medicine, there's a 1A and a 1B criteria, and they're very different criteria for scoring. And depending upon how that hospital or sleep center is scoring it can greatly impact it. And so the point of the matter is, listen to the patient, and the study may support what you see, and if not, question the study. Just like if you take a blood test and all of a sudden, let's say your blood glucose is way out of range, but the last time you did it, it wasn't, and it's like, boy, if anything, I've been eating and exercising better. Repeat the test. Don't all of a sudden panic, because there are errors made in testing, and in sleep, the errors are tremendous. And AHI is a measure of whether the AHI, that number, apnea-hypopnea index, could be mild, moderate, or severe, but it doesn't mean the patient's symptomology or effect is mild, moderate, and severe. And that's a confusion that needs to be talked about, because the AHI is not the patient. The AHI is a number, and within that number, there can be all kinds of scoring errors.
I've heard you say in the past, mild sleep apnea can have severe symptoms. So that's, basically what you're saying there.
And it was Sydney's case. So you asked, what did we go through? The first test we went was a sleep study that we filmed. And the conclusion of that sleep physician was that Sydney had narcolepsy, and that he prescribed amphetamines like Ritalin, Vyvanse, those things. And I just didn't think he was right. Based upon, I didn't know even what I know now. I just like, this is my daughter. I don't think she has narcolepsy.
Right.
When I see the symptoms, it doesn't seem to go with Sydney, and Sydney didn't think she had narcolepsy. And so we said, I don't think he's right. Many lay people would just say, listen, he's the doctor.
Right.
We should go on amphetamines.
Right.
What's interesting is just recently, in the last 2 years, I had a sleep study, my husband had a sleep study, and the insurance would not approve an in-hospital sleep study, only an at-home sleep study, which I have to then believe that there's even more variability, because I don't know what to look at with him and he doesn't know what to look at with me. But if that's like the wave that people are making that recommendation, I imagine then more and more situations like this will go undetected or untreated or mistreated.
100%, because the way you pick up an arousal on a hospital sleep program is based upon, electrodes, EEG. And so when you don't have that information, they're picking up a change in the flow of the air, or a change in your respiratory rate or your pulse. So there's at-home sleep tests give tremendous information and insight, but there's times, again, if the symptoms scream that there may be an airway disorder and the home sleep test doesn't support it, then I think it needs to be investigated more, whether it be with a polysomnogram, which is the in-lab sleep test, or doing a DICE procedure, which is where they put a patient to sleep and they look with a scope through the nose at the soft palate, the back of the tongue, the base of the tongue, and the epiglottis, and you can visualize whether those are collapsing with sedation, which is trying to mimic sleep. And it was actually that test that was the key. You want to talk about that?
Yeah, I mean, the sleep study that I did, again, it did not show that I had sleep apnea, or they thought I had narcolepsy. So it really wasn't showing anything. It wasn't supporting how I felt. I was told, if anything, it's mild, just kind of dismissed.
Yeah.
When we went to do the DICE in California, they gave me the tiniest bit of sedation to start to relax me, and it knocked me out. And they had to, what is it called?
Shin thrust.
Shin thrust me to keep me breathing.
Wow.
And while I was out, they put a CPAP on to test to see if that would help me, and it didn't, based off of where I collapsed. And when I woke up and came out of it, the doctor said anything short of MMA surgery is not going to help you because you've collapsed in 4 different areas. But my
Wow.
sleep study didn't pick it up. Because essentially, once I was collapsing, my body would have these micro arousals to keep me breathing. So I was never getting into the deep and REM sleep that I needed. So my whole life, I wasn't really getting that restorative sleep. But I felt like I slept through the night because they were micro arousals. So it's just you have to listen to the patient because why would they make it up?
Right.
Right, and I guess the practitioner too, right? Because I'm sure for many, if they hear, okay, well, you do have mild sleep apnea, and okay, well, we figured out what it is. How do we work through it? But being able to be persistent enough and look for what if that's really accurate or if it's a true reflection, I think says so much about the patient and the family or their support, because I feel like everyone's goal is like, okay, we have an answer now, let's all right, move on, not to continue to pursue if that answer is correct.
Mhm.
Right, so if a new thought of ours, and it's not original to us, but to some degree, I think people have an airway disorder until proven otherwise, rather than their normal airway until proven they have an airway disorder. And why do I say that? Well,
Okay.
snoring is an airway disorder.
Right.
That snoring is not normal. Everybody agrees that's right,
It's
because
common. It's just not.
it's common, but it's not healthy. It's an airway disorder. Oh, by the way, crowded teeth, that's an airway disorder. That's indicative of an airway disorder because your jaws are too small to have 32 teeth. And mouth breathing is not healthy. That's an airway disorder. So if you don't limit airway disorders to obstructive sleep apnea,
Right.
but include upper airway resistance syndrome, mouth breathing, and snoring, then you say, oh yeah, everybody has a problem until proven otherwise.
Right.
And so then if there's symptomology on an adult, whether it be high blood pressure, diabetes, anxiety, depression, an event like a stroke or heart attack, and you recognize that everybody has this problem until proven otherwise, we should be testing for it because it's probably one of the root causes. And with children, why would you want to wait until it manifests as a problem like a learning issue or a self-esteem issue because they have issues, cognitively? Why not, if you recognize it early on and you say, listen, probably everybody's got an airway disorder until we prove otherwise, let's check it because they're already showing signs, whether it be their snoring, their mouth breathing, or the fact that they're having issues with socialization, emotions, or school. It should be enough to say, let's test. And that's the point. And so it is a global epidemic. I think you mentioned, there's a recent study, 2019, 2020, that extrapolates and suggests that there's 1 billion people with obstructive sleep apnea alone. That doesn't take into account these others like upper airway resistance, and that's over 100 million people in America. It is everywhere, and so it's in who's ever watching. It's in your family. It's your child, it's your spouse, it's you, or it's your parent. It's almost a guaranteed because modern man, between the lack of breastfeeding relative to 450 years ago, soft processed foods, moving indoors, allergies to carpets, pets, all these things has caused us to grow more like pugs rather than, animals with big snouts and forward jaws. And so we're all on the precipice.
In your opinion, what would be the symptoms that would make someone look for this potential disorder, and at what age would you think the best time to do that is?
Go ahead, Sid. I always like to hear from your perspective.
Non-medical person here. But I'll give
Yeah.
what I've learned and then you can jump in. But the earlier that you can pick up on it and start treating can really change the trajectory of someone's life. So once you kind of pass, I think it's 6, it really becomes much harder to change the trajectory, and it becomes much more about management rather than prevention or really treatment. So the earlier you can catch it, the better. So I mean, red flags, I think some people even say like in utero, you can see some things, but I know once a baby is born, if they're having trouble latching and feeding, that's already a red flag right there. You know, colic, I don't even know the other ones, but
Yeah,
like those,
digestive problems for a baby, and then, runny nose, earaches.
right. And then it's so normalized now to give the kid a pacifier or to, you know, use bottle feeding more so than breast. And everyone has to make their own decision what's best for their family, but everyone should be able to have the education to then make the decisions that's best for them. And I think it's rarely anyone knows that pacifiers are causing the tongue to sit down in the mouth. So already you're setting your kid up for this poor growth and development of the jaw. And that's just such a, a quick idea and a quick thought, but almost no one knows it. So, I mean, keep the pacifiers away from the kids and, try to breastfeed as much as you can. I think already there, okay, those are two huge things that can start to, give the kid a better chance to have an open airway.
I'm totally taking over. I haven't let you ask
No,
one
that's
question
okay.
yet, because I have another one. I'm so intrigued.
Go ahead.
What would you say of this population that are tongue or lip tied?
I don't know the answer to it, but certainly, Lisa Palladino has been a great mentor to Sydney and I in terms of, she's a lactation consultant and nursing background and midwife, and she's taught us so much, but certainly if there's an issue with latching and feeding for the baby, a tongue tie needs to be evaluated, and Scott Siegel also has been so helpful. So I think you just can't overlook that, and we recognize how critical breastfeeding is to the development not only of the immune system and the bonding with mom, but what most people have no idea, that structurally it's a game changer in terms of developing forward growth and a wide palate and room for the tongue and room for the nasal structures. And so if it's a tongue tie or a lip tie that's preventing, that's a very simple mechanical treatment with the help of a midwife lactation consultant can change the course of growth for the better. Oh my goodness, what an opportunity. It's inexpensive, it's virtually painless, and it can be just a game changer. And again, I knew nothing about this as a young parent. It wasn't,
No one in our family was breastfed. Like we didn't know any of this. So there's no judgment from us either. And whenever we speak with Lisa, she always starts with saying that, and I appreciate it. But just for the listeners, like there's no judgment here because my parents didn't know better, and
I
now
think
we're
it's
learning, so we're trying to educate other people so that they have the information to make the choice that's best for them. But
Absolutely.
I'd like to have learned as a dental student, both because I was going to be a parent, but also because I'm counseling, young families. It should have been part of my education. And not only was it not in my education from 1983 and 87, which is when I went to dental school, it's not in the curriculum of any dental school now.
Yeah.
And that's a big problem.
Yeah.
Which I know you're trying to change that, and there's a bunch of professionals that are trying to change that. So hopefully that happens. I know there's been some movement there.
Yeah, I think we've really been counseled and learned as we've worked with now 2 different universities that really change is going to come from people, meaning people that are watching this, some of which have a profession that's intertwined with this, and some that are parents and spouses and moms and dads and grandparents, but it's the people that are going to change it. And by the way, I mean, who does biopharma advertise to? They make these musical commercials so that they inform you there's a medication for your ill, and that has changed what doctors do because there's the demand from lay people. And so it is with this whole piece relative to airway, breathing, and sleep, is that the people are going to exercise their voice, and that's really what's universities are going to respond to. And the airway revolution is certainly we've taken that as our responsibility to, by telling these stories, also developing this grassroots movement so that we can then change education and then ultimately change Medicare and Medicaid reimbursement. And so it's not going to come from deans that say this is intellectually interesting and we should teach it. We've been told by deans that's not going to happen.
We've tried it.
Yeah, it's when faculty and students say we need to be teaching this because, oh my goodness, it's the reason for periodontal disease. It's a root cause of dental decay, which is right where we live with these kids. Oh, and it affects, heart disease. And so our medical colleagues, it's an interdisciplinary thing. This needs to be taught. The four of us know this and it's so obvious, but you could beat deans over the head. It's not going to change until the students and the faculty respond to the public and say, oh yeah, we need to teach this differently. And it's important because it validates then practitioners like yourselves who are counseling your patients who are coming to you for articulation issues or learning issues or behavior issues, and you're talking to them about airway disorders and sleep, and they're like, listen, that's not why I came here.
Crazy.
Yep. Yep.
Mhm.
And
But
the
when
lack of education from the professionals is not helping us either because we're referring to them and they don't know what we're talking about.
Right.
That's why we need universities, they're always 20 to 24 years behind
Wow.
practice, and that's a study that's been done, but we still need them to validate that this is important by teaching it, and then all of us who are somewhat outliers become leaders and innovators because, hey, yeah, we've been saying this is important for a while and we've been counseling, and now those referrals are met with, yes, we realize it is important because, Columbia is saying it, Harvard is saying it, and LMU is saying it, yeah.
Yeah. And so you're talking about people sharing their voice and their stories for that demand. Your website at the foundation has the, share your voice. So that is where people can go, correct, to share their story. Mhm.
Absolutely. People can go there and share their voice. And we have just started our social media journey, which was not an easy journey for us to start, but luckily we have someone great helping us. And we plan to start sharing some stories on there as well. So we welcome people to, reach out to us. And if they're willing to share their story via social media, we would love that, because I just think when stories is what motivates people and what motivates change. And I also think there's so many people living with airway disorders who don't know it and don't recognize it either in themselves or a loved one. So you don't know whose story is going to touch them in a certain way where they have that realization of, oh my goodness, this is me. Or, oh my goodness, this is, my son, my daughter, my child, whoever it is. So the more stories that can be shared, the more perspectives and journeys that people have been on that we can share with the world, I think the more impactful it will be.
With that younger demographic, especially children, do you have any advice for parents where they should rule out these areas first, and then if nothing changes, then this, and then pursue? Because I definitely feel that, especially from practitioners, we're ruling out tethered oral tissue, then we're reading out, enlarged tonsils and adenoids, we're reading out sleep apnea. So we're going through the list, depending on symptoms, and some of those things they need a splenectomy, they need their tonsils and adenoids out. But at that point, then what would allow a parent to know that I really should be pushing this further, especially when it's with a younger demographic?
Yeah, I think right to the point is we need to be measuring the effectiveness of treatment. And oddly enough, it's greatly missing in the space. What do I mean by that? So with children, you do tonsil and adenoid surgery. Sometimes they've had a sleep study before that, but very often not. So it would be very good to have a measurement before a treatment and then measure sometime after the treatment to see if it was effective. I know that sounds so basic, but that is not the standard of care.
Right.
And there are at-home sleep tests, like Sleep Image Ring is approved, I think, for children 2 and older. It's a ring on your thumb or your forefinger. I've used it many times. It's FDA approved, so it's a step up from Aura Ring, which is not an FDA approved device, or your Garmin watch or your Apple, which are biofeedback mechanisms that are very helpful. But there's actually a test, so children could wear that, and then if something's done, whether it be tonsils and adenoids, myofunctional therapy, then measure again to see if it's impacted it, and has it impacted it enough, because maybe it's improved it, but not enough. And so then you go to the next step and the next step. And that's why I think the reality is it's very personalized when it comes to treating airway disorders, which is basically anything that interferes the flow of air from the nose, past the soft palate, past the back of the tongue to your epiglottis. That's the upper airway. And an airway disorder is anything that interferes with that smooth flow of air. So if you treat something that might impact it, you have to measure it and then make a decision. Hey, we've solved the problem. I mean, I've had a boy, Michael. He came to me, I think, at age 8. He had tonsil and adenoid surgery. It helped, but it didn't help enough. We did a growth guidance orthodontics, and that helped quite a bit. We did myofunctional therapy, and we tested many times. And by the end of it all, yeah, his sleep shows to be totally healthy and it didn't before. And yes, his affect, his ability to learn and do life successfully has changed, and that's critically important. But I think it's critically important to measure, otherwise you don't know when to stop with your care.
Right.
And I don't know another way around it. In most other things we do in healthcare, we measure to see if what we've done is effective, and if not, we change the tactic. Even with teachers, right? They teach a lesson, and if they find when they test the students, they didn't do very well on the test, it's a feedback to say, hey, we didn't test it well. They didn't get that division, so we got to teach it differently.
Yeah.
It's different here. We need to test to see if what we're doing has been effective.
Yeah. And I think, as you said, like there's sometimes not just that one treatment, it's that interdisciplinary approach. It was, maybe he did need that tonsil and adenoidectomy, but it just wasn't enough because we needed the growth and we needed the myo, and that all together is what helped this patient.
Exactly. And I think a piece that's often overlooked and missed is nutrition as well. Like, what are we eating? Do we have a inflammatory diet? I think sometimes we get off of lifestyle and we just look at, anatomical issues, which of course it plays a huge role, but so does lifestyle. You can't outrun lifestyle. So I think that that's a piece that needs
What
to be
is some of that lifestyle that you would say for like the more pediatric population?
Say that one more time. What was the
What
question?
are some of those lifestyle like things to consider, would you say?
Go ahead.
Well, I think nutrition, the standard American diet has been called SAD, and it is. And
Wow. That's
again,
actually so true. Yeah.
I'm not passing judgment. We fed our kids, chicken nuggets and pasta many nights.
Mostly.
And pizza. So, judge not lest you be judged. But the truth of the matter, it wasn't a healthy diet, and it certainly didn't help Sydney.
Right.
And so and there's so many reactive allergens in these foods that if we're not trying to give a whole food diet, stuff that grows from the earth, and the more we get away from that, and the stuff that's on the outside of the supermarket is better than what's in the middle aisles, the more we're processed foods, we're creating more potential soft tissue inflammation. And that airway is really the change in a small change in the airway is to the third power, and it's based upon the Bernoulli effect. But I'm not a physicist, but I do know that if you just change the diameter a little bit, so give foods that are creating allergies, and the soft tissue flares up anywhere along the airway, now you have to have increased effort to bring the air in. And as you create increased effort or increased negative pressure in the abdomen, then the walls of the airway collapse more, because you're sucking harder. If you take a straw and you suck gently, it doesn't collapse. If you suck really hard, the walls of the straw hit each other. And so you throw a little poor diet with increased effort, and now you have a very collapsible airway. And so it doesn't take huge things to make a difference. And I go back to, we're all on the precipice because we have flatter faces. And so these nutritional things are a huge component, as are environmental things, a la our dog Duke, which was really one of the key sources of Sydney's issues early on, which caused her to have to breathe through her mouth, which changed the growth of her face. And ultimately, Sydney ended up having MMA surgery, double jaw surgery. And maybe you should talk about the impact it had on your life, restoring your airway.
Agreed. And is there an age at which you can only have that? So is it once you're done with growth and development? So if we are intervening early, what are the things that we should be doing as that early intervention if that MMA surgery cannot be done until a certain age?
Yeah, so everything that would encourage lips together and nasal breathing, that's huge because, and so lips together, teeth touching, tongue up on the roof of the mouth, as you both know well, and that's where you live every day. That proper oral rest posture is what I've learned to call it, would, in a child that's growing, stimulate the palate growing wider because it's growing around the tongue that's resting up on the roof of the mouth. And the tongue up on the roof of the mouth and the lips together are stimulating forward growth of the face. Behind the teeth is the airway. And so if you get forward growth and width for the tongue, you're developing a beautiful airway. And so those are the things. So anything that helps with that. So if enlarged tonsils and adenoids are messing with getting your lips together, it needs to be a consideration. Now, they could be enlarged because you have allergies. And if you eliminate the allergies, the tonsils shrink. But at a certain point, you need to make a decision. How long am I going to let my child hang their mouth open before I manage it? And I'm saying not very long.
Yeah.
Oh.
Do you want to come?
Can
Yeah.
Okay.
I get a view of the puppy?
Yeah, we need a view.
Aww.
Notice they're
Smaller
all
version of that.
they're all poodles, hypoallergenic.
I finally learned.
Yeah, Sydney, I would love to hear a little bit about your journey. As your dad was mentioning, I think it would be really helpful to hear about that procedure and how it really helped change your life.
Right.
You know, along the process of figuring out, we pretty much thought, okay, this is an airway disorder, but what is going to, you know, fix it for me? We tried mandibular advancement devices. I tried CPAP machine. Those I guess were, you know, anatomical, but even before kind of we were on this airway path, before we knew what it was, I really worked on my diet. I was vegan, I was gluten-free. I really tried to stay away from processed food. I exercised almost daily, 5 times a week. Like I was pretty religious with it. Meditated. I studied Ayurveda, which is like the sister science of yoga. What else did I do?
You did myofunctional
I did
therapy.
myofunctional therapy. I did that other specific type of myofunctional therapy. I don't know. We had to
Did
make
you take a
videos.
breathing? I did take a breathing trainer.
Yes, yes, we did that. I had one of those books that he talked about early, Close Your Mouth. I remember
Yep.
when I was little and I'm thinking, what the hell is this? And then who knew that I would be here where I am now? But I tried to read a lot of books, but before my surgery, I could not get through a book for the life of me. But I did attempt to read about, you know, health, nutrition. I even became a health coach. I became a board certified health coach to try to learn more about health and like, why can I not get healthy? Why is everything that I'm doing not working? We tried a lot. Yeah, I saw a naturopath, I got acupuncture. I mean, I really was exploring all different areas of health and wellness. And for me, the answer was unlocked once I got MMA surgery, where essentially they bring both my jaws forward to open my airway And they also fixed my deviated septum and turbinates during that surgery as well.
Wow.
And it was a tough recovery, and it's come a long way. Even I had it 4 years ago, and it's come a long way. Where I had the surgery in like 7 hours. There's a surgeon doing it in 1 hour now. So
Which
it
blows my mind.
blows my mind. That's why we had to go see it. But it's
Yeah.
a real deal, and it was like, wow, it's
Wow.
amazing what he's doing. So, but it was a life changer for me. I mean, I always say it's hard to explain because you just kind of feel new. Like you just, because you get so used to like thinking a certain way and kind of understanding yourself of, I know that I won't get that, or I know that I can't concentrate on something like this. You come up with like mechanisms to make it work and like get you through life, I guess. And then post surgery, when I could like perceive information differently. I could understand more. I could concentrate. I could sit through lectures and I could read books. It's just like, whoa, what happened? So it's kind of hard to explain unless you're going through it, but it's like you're getting a new chance on how to take in the world and how to take in the information and interact with people. I mean, I had pretty bad social anxiety before my surgery, and I'm grateful because people could say that's bad, that's good, but I had parents who pushed me like, no, you're not sitting at home, not talking to people. You have to go out. You have to do this. Go shake their hand. So I was pushed into really uncomfortable situations for me so I could make it through.
Okay.
But I don't feel that way now. I'm like, let's go chat. Let's go, so it's like such nuanced little things that have just totally shifted in my life. I mean, besides those were kind of the biggest things for me, but also I'm not exhausted anymore. I can get through the day and keep going and, have an active life. And I just feel good. Like I wake up and I'm like, hey, it's another day. Let's do this. Where before it was like, oh my God, I cannot believe I have to get out of bed and like do anything.
Wow.
So it's really just like another chance
Mhm.
of like living the life that I knew that I wanted to live, and like what I had inside me, but I couldn't access. And now I can access it, and I just am so grateful to be able to like live kind of my authentic life, and like this is what it was supposed to be. I just couldn't access it before.
Wow.
Was there a point, Sydney, where you felt like everything you tried hadn't worked and you needed to go further? Or at the point where you were like, okay, I've done all of this, I'm done. This is obviously who I am.
I guess I just didn't know. Like I had always felt that way. So it's hard to know, like, now I'm feeling bad. I need to fix it. I never felt good. I felt like I was just getting through life. But you hear like that's how most people or a lot of people feel. But a lot of people have airway disorders. So it makes
Yes.
sense. But when you're talking to others, it doesn't sound so different from me. Maybe I'm being dramatic, maybe I should just get over it. No one can find anything that's wrong with me. And I remember like being really hard on myself, like going to my Ayurvedic doctor who I love and who I studied with and I traveled to India with, and, her talking to me about, your issue with your gut is you're not being mindful while you eat, and you need to really enjoy and be thankful for each meal. And you're sitting there and trying to be like, why can't I be more mindful, and just like getting so hard on myself because I felt like it was my fault that I was unhealthy. And it's not. I mean, like it's environmental. It's not having the knowledge and the education, and sometimes just how it is. So I don't know if I had a moment in time, but I know that when my dad came back saying, I think you have an airway disorder and I think this surgery could fix it, I was like, let's go right now. Like, I'm ready for the surgery tomorrow. I didn't even need to hear more because I wanted to feel good.
And
Yeah.
sounds like you had a lot of like awareness of what you knew could be better, but I feel like, do you both hear and find that sometimes it's like they have nothing else to compare it to, so after it's better they're like, I never even realized I wasn't sleeping good, I never realized.
Absolutely. I think it's like I kind of said, like a lot of people are struggling and like just making it through and like white knuckling through life, and that's all they've ever known. So like, why would I go looking for more? Because I don't even know that there's more out there. And I don't know why I felt like there was more. I think just on paper, it was really hard to like be any healthier than I was, but I didn't look healthy. I didn't feel healthy. So I knew that something was missing. And this was an avenue that not many people were talking about. Of course, like when I studied yoga and Ayurveda, breath work and breathing is a huge component, you know, it's like the essence of life. But if you can't breathe properly, what are you doing, you know? So it made sense to me. Okay, anatomically, I'm not breathing properly. I can't breathe properly. What's going on here? So
And
Dr. Avis, do you remember a time where you noticed that something regarding her airway or airway issues was present before Sydney was able to advocate that for herself?
I think I really didn't put it together till I learned, you know, from John Mew and Bill Hang and Michael Mew about the palate being narrow and high. And I said, oh my goodness, Sydney had crowded teeth. Fortunately, nothing was pulled out in terms of teeth, but she still has this narrow, high palate, and she was allergic, and so she's a mouth breather, and that's when I said, oh my goodness, those three things, you know, mouth breather, anatomically having that type of a palate, you know, and again, I didn't have the conviction that I had now, but I said, well, those are red flags for an airway breathing disorder, and certainly seeing it with an inhaler on the basketball court. I mean, is asthma related? Well, now I know it is, but in those days, and mostly today, you know, asthma is a lower airway disorder, not an upper airway disorder, but we know they're intimately tied together. And so I just think that's when I started to realize, when I saw anatomically and in terms of her symptomology, that, oh my goodness, I think that's what's going on here. And you know, and I just really, I had a lot of belief in my mentor, Bill Hang, and he was so certain that, hey, she just needs surgery, that I felt, you know what, he's been around doing this a long time. He's probably right. So it gave me the conviction or the support that I needed to keep at it with Sydney, and she was willing. You know, she had the desire. I mean, it's really, I give Sydney so much credit, because not only did she have the desire to go for something that, like you're asking, we didn't know if it existed. Was
Right.
there a way for her to feel better? It was an unknown, but she had that strength to do it. And then on top of it, that Sydney was willing to share her story. I mean, she's not in the field, right? Although she's a health coach, so she is in the field. But you know, that was very selfless, and that if we shared her story, we might be able to help millions of lives. And now it's sharing many stories, and the goal is to save tens of millions of lives. And Sydney put it all out there. I mean, when she had that surgery, the cameras were rolling 2 weeks every day. We were in St. Louis, and they were filming Sydney, and it was not a time that most anybody would want to be filmed. And she was doing it for others. And it's easy, you know, Sydney would never pat herself on the back, but I pat her on the back. I mean, there's loads of people that have had MMA surgery, and few, if any, have made a movie about it.
100%.
Yeah, and Sydney's willingness to share that story. And again, we did it prospectively. We didn't know that what we were going to do was going to solve the problem. So we filmed the process with the expectation that we were going to, but it was a risk. There's no doubt about it. You know, a risk of time and money that we would tell the story. And then, of course, we became very self-aware of privilege. You know, I had the money, we had the wherewithal to travel and see all the experts. And so we were really concerned that the documentary would fall because of that. And so you'll see when that documentary comes out, it is not a film about privileged people. We are filming people from all different walks of life, different ages, different ethnicities, different religions, because airway disorders don't know those parameters, and they affect everybody. And yes, there is a difference in access to care, but we can impact that if we help the world understand what an impact this is having on chronic disease, and we intervene early for all people. We know that we can economically save insurance companies, hospital systems, billions of dollars. And we even have now, as part of our advisory board, a health economics expert to really work those numbers to help people understand what those savings will be. So anyway, I talked too much, but
No, not at all. I promise this is my last question, unless you have another one, Toni-Ann. As for parents, especially with a lack of understanding and generalization in the medical and dental community regarding airway, as a parent, if you were advising a parent, would you say, first, if you're tongue-tied, have your frenum released, then, okay, that's not working. Your adenoids and tonsils are enlarged. Okay, have those removed. Okay, that didn't help. Go through palate expansion or ortho. Like, is there things that they should be checking off their to-do list before saying, I really don't notice a difference and I need to take the next step?
I mean,
Go ahead.
so as a preface to it, parents need to understand that most physicians, dentists, SLPs, and allied health people have not been educated on this topic, so that if they see a door closed, it's very often out of ignorance. And I don't mean that in a belittling way. It's because they weren't taught this. And if they didn't seek further education like you both have, was it this part of your SLP curriculum?
No.
Not a day.
And it wasn't part of my dental curriculum? Was it part of your health coaching curriculum?
No.
So I say that because you have to seek professionals that are airway interested, airway educated to start with, because otherwise you could get a lot of misinformation. And then within that, many of the airway people know their space. So some dentists know mandibular advancement devices or expansion, but they don't know much about MMA, double jaw surgery, or they don't know much about tongue tie releases. And there are pediatric dentists who do tongue tie releases, but don't do expansion in orthodontics. And so it's very important to understand what's really missing in this space is a quarterback.
Yeah, good
Help
point.
direct the care.
Yeah.
And most physicians, dentists, and SLPs aren't reimbursed to be that quarterback. And then what we do is, by and large, we go out of our zone for family members, close friends, because we know too much, and they're willing to take that information. So it was a long entree, but the key is you need a quarterback, and it could be a dentist, it could be a pediatrician, it could be an SLP, it could be a myofunctional therapist that's either an SLP or a dental hygienist. And for goodness sake, I'm telling you, Sydney can health coach and knows more about this space than most, because she's been in it for 7 years and lived it. So the title's not as important, but to understand that we need an eclectic understanding of all the spaces. And then to that, you don't want to waste time with children, because I think most of the neural development is done by age 6. It's like 90 to 95%. So those first 6 years are so critical. So this kind of will wait, they'll outgrow it. I do not like that statement, because time's a wasting and you don't get that back. And so you need a trusted guide through this. It is a place where we believe in the future, the airway revolution can hopefully be a big help in that, but we're not there yet. But we see that as a missing piece, because people need to kind of know, what do you do next? What do you do next? What do you do next? But certainly starting with conservative care can be correct. But sometimes tonsil and adenoid removal can be a huge bonus, and to just say, well, surgery is the last step, that's not necessarily the right case. So that's that personalized journey, this child, tonsil and adenoid might be the first thing you should do because it could change that neurocognitive development in a fast way. But maybe some children can use a CPAP machine to buy time, and for others it might be an allergist. And so that's why I don't want to make it complex.
Mhm.
It doesn't need to be complex, but it needs to be guided. And really, you two are quarterback for many if they'll take that advice from you, because your title's SLP, but you've taken so much education about airway disorders and sleep, and children that I would trust your advice if I was a parent. And you didn't get me on this program to say that, but I mean that. I mean,
Thank you. We're
you
not
guys-
editing that one out, by the way.
yeah. So if you're listening to this and Janine and Toni-Ann, you have your quarterbacks,
Yeah.
and they know others in Long Island that can be key people for you, like a Scott Siegel and others, and Steve Lamberg, and there are people that they know, and so you're very lucky if you know these two.
Thank you.
Thank you. We
And-
do feel lucky,
Yeah,
right?
and
Yes.
we do often feel like we're that center person that's trying to help the parents and families navigate. But I think what's nice about that, being the speech pathologist, the myofunctional therapist, is that we're seeing them twice a week. We're building this rapport with the families. We're seeing them so closely. So it's a nice opportunity for this audience, this professional, to be educated in this area, and why we would agree it should be in our education. It should be part of what we learn too.
Yes.
And
And
I
most
just-
families don't believe the SLP. They want to hear it from their medical doctor or their dentist. So when they're not getting that support, it becomes frustrating to be the quarterback
Mhm.
because you know what needs to be done, but you're not getting that support.
Mhm.
And Janine, I was going to say the same thing in a different way.
Okay.
I'm now 62, so I'm old enough to say this statement that she's just a hygienist, she's just an SLP, he's just a dentist, she's just a pediatrician. Forget this. These titles are just, it defines where we went for an educational program. It has nothing to do with the scope of learning we've done since then. My dad, who's 95, still alive and is a dentist, who told me when I graduated dental school, he said, Victor, this is a license to learn. And so these titles don't define a person or their scope of knowledge. And we need, as patients, to put our trust not in a title, but in a person. And you two embody that. You are lifelong learners, and you impart it to your team of therapists, and it's incredible. And so you're not just a speech therapist, and you're not just a health coach, and I'm not just a general dentist. We are people that have invested ourselves in helping people live better lives, and that's who we are. And we're on an equal playing field, and people need to just get rid of the titles, for goodness sake, and trust the people, and just try to get to know what they know and say, oh, I can benefit from my relationship with them.
I love
I
that.
know that gets an applause.
Exactly right. That was amazing. And I
Got me fired up.
Can I quote that?
And,
Can I trademark it? There's a whole nother.
yeah, go ahead.
Before we end this, though, let's get back to the documentary series. What's the update there? When can we expect that out? What's going on? I know there's been changes even since January.
So we just had our last big film travel trip in
Wow.
Houston just a couple weeks ago. So that kind of was like, wow, we made it to this point. So now all it is, it's like a couple local days that we have to finish up, 2, maybe 3, and then we're done. It's in the can. It's all post-production. They've already started post-production, so it's not like, we have to wait for these 3 days to go by and then we start. So they've started kind of editing and that whole process, which I know will take a while, but we are looking at 3 1-hour episodes in this
Okay.
mini documentary series, and we're hoping for it to come to be ready by next year. And of course, we have to go through the distribution process and whatnot, but we're hoping for next year.
That's exciting because I think we'd both say that the extended trailer, which was only a few minutes that we got to see, was very inspirational, and we know it's going to be a good one.
Absolutely. And
Yeah,
something
we're
we should be
excited.
encouraging people to watch.
Mhm.
For
We're excited. We're excited. It's been
us
a
too.
long time coming.
It's a lot of work. It's a labor of love.
Yeah.
It really is.
Who
And there's
knew it was so much work making a movie?
Right, and I would,
I really didn't know.
and
and then
I,
it passes. You're like, here's nobody to know. Whatever. It's 9
yeah,
years of my life.
but I would say like Ed and Orly, our director and producer, I'm supposed to say Orly and Ed, our producer and director.
Yeah.
I mean, they went from like disbelief, like Sydney's healthy, athletic, what is this all about? To recognizing, oh my goodness, this is an unbelievable opportunity and honor to do this project because it's so important. And so just to see the film crew, almost every time we film, because sometimes in other cities we need, sound people and lighting people, and all of a sudden the questions and, oh my goodness, do you think I have, what can I speak to you about this? And it's just been, we're so validated all the time, both when we speak publicly or when we go film, that, oh my God, this is really important. And I'm so glad we're doing this project. So anyway, and you're helping us because the most important thing is that people follow the foundation and anticipate the film, share their story, because we need it to be a movement of the people to create educational change, more research dollars, and better care in the future.
Yes. And the website is, if you want to give them information of where they could find out more about the foundation.
Yes, you can go to airwayrevolution.org, and you can also follow us on Instagram, and we do have a TikTok.
Ooh.
And I think the handle is just at Airway Revolution. So we are definitely pumping out more content than we ever have before. And yeah, follow us there.
Yay. And then we're also hoping to get you guys to Long Island. I know that's in the
Yeah.
works for the fall. So hopefully we'll be able to bring you in real life to our audience.
That'd be great.
Absolutely.
Yeah.
Thank you so much for taking the time to speak to us. I mean, I could probably be on this call a million more minutes because I could always ask questions because it's so intriguing, but it really has educated Toni-Ann and I too, to a whole nother area. And just the way that we can support our patients and the families and even our own staff. Again, building that education, like you said, it has to be a movement. So we're committed to that movement along with you. And if there's anything else that we can do in the future to support you, we're happy to do so.
Yeah.
Thank you
Thanks.
so
And we
much.
really do believe the film will so much support your efforts because, when your patients see that film and they've heard it from you, it's another point of validation. And the film represents so many experts from around the country and around the world that, oh my goodness, Toni-Ann and Janine, they are on the cutting edge because what they're telling me is what I'm seeing in this documentary series. And this documentary series, it's an independent film. No biopharma or technology company is buying their way into the film. So it has complete integrity, and it's an honest piece and it's a positive piece. Nobody is going to be embarrassed in the film. But it's going to help elevate people so they can get better care.
Amazing.
Amazing, amazing, amazing.
Yes. Thank you both for everything that you do. And of course, for joining us on this tonight.
Thank
Great.
you for having us. Thank
Great.
you for what you do.
Yeah.
Oh,
Thank you.
thank you, thank you. Have a wonderful evening. And again, thank you for your time.
Okay,
Thank
we
you.
enjoyed it. Thanks so much.
You're
Bye-bye.
welcome. Good night.
Good night.
Thank you for joining us on this episode of Talk the Talk.
We hope it was enjoyable and educational and further supports you both personally and professionally.
For more information, please check out our Wyo Mayo and Mayo Minute podcast, as well as our other episodes of Talk the Talk. And don't forget to check out our tongue training appliance, Spot Pal, to help with tongue thrusting, thumb sucking, snoring, TMJ, mouth breathing, and so much more. Visit thespotpal.com.